Welcome everyone to today's webinar. I am Brian Zimmerman with Becker's Healthcare. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. We are thrilled to have Brian Q. Davis from Scorpion Healthcare to moderate today's webinar. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Additionally, in about a week following the webinar, we will be sending you a copy of the presentation to the email you used to register. At this time, it is now my pleasure to start today's webinar by introducing our presenter. Brian Q. Davis is Senior Vice President of Scorpion Healthcare. As Senior Vice President, Brian leads Scorpion Healthcare's vision of bringing a new level of competitive advantage to healthcare providers online. His responsibilities include go-to-market strategy and business development for Scorpion Healthcare. He has been a speaker and panelist at various healthcare industry conferences and has been quoted in Becker's Hospital Review. He has been a panelist at Becker's CIO and Health IT Summit. He is also a member of the Society for Healthcare Strategy and Market Development Digital Tech Force. Brian, I'll now turn the floor over to you.
Thank you, Brian. I appreciate the introduction, and I want to thank our friends at Becker's Hospital Review for hosting and putting on this presentation. I also want to thank everybody that's joined us today for investing a little bit of your time and attention on Thursday to talk about a path forward. There's no doubt that things are in flux in our industry in almost every area. So we're going to talk a little bit about that today. Just again, to introduce myself, as Brian mentioned, I run the healthcare division at Scorpion Healthcare, based out of Dallas, Texas, originally from Louisiana. That's great, but here's the thing you need to know about today's presentation. There are going to be prizes. So it's important that you stick around to the end. There's going to be opportunities to get involved in some invite-only events, and there's also going to be some prizes, but you have to be at the end and you have to pay attention to be able to claim some of these. So just to give you a quick 30 seconds about Scorpion. Scorpion is an organization that is founded on helping organizations maximize their ability to extract value from using digital web technologies, basically using the internet to attract their most valuable clients. We work in three primary verticals. We were an industry leader in the legal industry. We were that was where we pioneered the use of the internet to attract clients to attorneys back in almost 20 years ago. And we realized very quickly that there was a big challenge with what healthcare providers were dealing with at the time too. We realized that attorneys trying to attract their ideal clients is very similar to healthcare providers trying to attract their ideal patients. In both scenarios, you're trying to reach someone that is in that moment at a very high level of uncertainty. And we got to be very good at doing that for the legal industry, and we moved that into healthcare. We also then saw that there was a big gap in terms of technology that was available to healthcare providers, and we built a platform specifically around the needs of healthcare marketers. Talk a little bit more about that later. But the combination of these two verticals led us also to be called on by large national brands who had the challenge of how do I scale digital marketing activities across the country, across multiple markets? How do I do that with a high level of quality? And we work with just over 40 national brands every day. But in the healthcare world specifically, we work with just over 200 hospitals and healthcare systems every day. So we're not an organization that kind of works in healthcare. We live and breathe here, and we specifically around the business of hospitals and their systems. The important thing to start this conversation with, though, is that, as I said at the beginning, is that the world has changed. The world has changed in healthcare in almost every way in the last few years, but specifically in the conversation around digital marketing, it's important to understand that the way the human race is communicating has changed and is changing. And it's incumbent upon healthcare organizations to adapt to where your patients are and where their attention is. It's changed. It's not where it used to be. And it's important to understand that it's not just where you're marketing or where you're not marketing, it's the way people are communicating. I recently went to a talk, and this fact was revealed to me, and I thought it was really it's one of these things you kind of don't think about because we're in the middle of it. But we're currently in the most massive cultural shift in human communication since the introduction of the Gutenberg press. where the Gutenberg press transferred human communication from verbal to written, we're now in this space where culture is changing because of the way we communicate. The person I saw in this particular speech said that in another 100 or 200 or 300 years, they'll look back on the time period between 1994 and 2030 as the shift, and we're right in the middle of that right now. But the important thing that we as healthcare marketers must figure out is where our clients are, where our patients are, and they're online, and that's where the conversation is happening. But okay, great. Why does that matter? Well, I'll have you consider that marketing in healthcare is a unique experience and a unique calling, because unlike other forms of marketing or other industries where we may be marketing services or products, we're marketing something that can have a massive impact on the life of an individual. And my personal story starts with my daughter, Perry Elizabeth, who was born just over a year ago, February 19th, 2017, at Dallas Medical Center, part of the Methodist Health System here in Dallas, Texas. 10:36 p.m. and Mom had done her job, and Perry arrived. But where my journey in this space started was my daughter arriving with a birth defect that nobody had picked up on until she was born. And I noticed that after she was born that there was something off with her feet. And I asked one of the nurses, I said, did you notice her feet? And the nurse kind of came by and was really busy and kind of wasn't able to connect with my question. There was a lot of stuff going on in the delivery room, as any moms or fathers know. I asked the doctor, and she was really busy, and she couldn't and this is all happening in seconds. So I wasn't getting the answers I was looking for quickly. And somebody said, well, that's just bilateral club feet. And some of you may know what this is. Some of you may have experienced with this. I had no idea what bilateral club feet were. But that's what my daughter had. And I went from this moment of intense joy to a moment of absolute uncertainty into what this is going to mean. Her ankles looked like they were broken. I didn't know if she was in pain. I didn't know if this was going to be permanent. I didn't know anything. I just knew that there was something off, and I didn't have the answers that I needed to be in the moment. So what did I do? I picked up my phone and Googled it, bilateral club feet. And in that moment, there was an ad, clubfoot treatment, Scottish Rite Hospital. Amazing, amazing people at Scottish Rite. By the way, if anybody on the phone is from Scottish Rite, God bless you, you're amazing. They placed an ad right in front of me at the exact right time, the exact right context. And on that ad led me to a page, which on that page was a video that had children that looked like my daughter. So I immediately knew I was in the right place. And in the very next frame of that video, I saw the same children running around healthy and happy. So it was a big, deep breath for me and an opportunity to get back into the moment with my wife and new daughter. That entire experience, and I actually have the entire experience was about 70 seconds. I actually have an audio recording of the birth. Now, my wife has told me I'm never listening to the audio recording. I guess I don't blame her. But I've gone back and actually listened to this, and I've actually heard this whole sequence of events happen. And that whole sequence from her being born to me asking a question and then getting an answer through my phone about what we were dealing with was about 70 seconds. And Scottish Rite did an amazing job being exactly the right place. They had engineered that experience to answer the question of a father that had moved from joy to uncertainty. And that is really what we're engineering when we think about healthcare and marketing. It's our job to do our best to reach people in that moment of uncertainty and be the brand or be the organization that's delivering a moment of clarity and confidence. And that's what I experienced. And that's when the gravity of what we do really landed on me. And this has always been something that's been important at Scorpion Healthcare. We always know that at the end of every equation that we're helping our clients run, there's a person. And that's why it is incumbent upon us as an industry of healthcare marketers to do this stuff really well. We can't phone it in anymore. We have to figure out ways to be more efficient. We have to figure out ways to be more targeted and ultimately serve our patients and organizations better. Now, the postscript of this story is that Perry went through about 6 months of treatment, of cast, and so on and so forth. The people at Scottish Rite were amazing, and now Perry is doing just fine. So her feet are in great shape, and she's as happy a baby as you can ever imagine. The biggest challenge I have is trying to figure out where to put all the shoes that the ladies at church bought her upon her last day of having to wear casts. But I guess the takeaway here is that these kinds of moments are happening thousands and thousands of times across all of the different service lines and all of the different capabilities of your system that you might be able to provide to a marketplace. And there are people out there that are looking, but again, attention is at a premium like never before. You've probably all heard the statistic that the that the average attention span in the United States is now less than a goldfish. So my experience in finding an answer took about 70 seconds, but it's important to be able to engineer how do we get somebody clarity and confidence in just a few seconds. And our friends at Google have alluded to how important this is. Brian Cusack, who's head industry over there, said, if you don't have a digital strategy already in place for a health system, you're already behind. It's not a problem you can hope to solve in 24 months. Consumer behavior and the nature of the internet changed too fast. You must be nimble. And unfortunately, that was almost 3 years ago. So it's just I guess what I'm trying to communicate here is that the sense of urgency must increase because the attention is online and it is important to master this part of your game, or you will be mastered by it, because there are definitely organizations, competitive organizations that are very good at this. And certainly we've had big entrants into the conversation recently with Amazon erasing $30 billion in market value in just 2 hours when they said, hey, we're going to get in this game. We don't know exactly what it's going to look like, but we're going to be in the game. And oh yeah, by the way, we're really good at disrupting entrenched industries. And we've done this about 24 times. And oh yeah, by the way, we're going to have all of the capital necessary to do it as long as we need. So those things are changing, and technology, of course, is changing. Who would have imagined this? This app, which is closely aligned and connected with Amazon, actually will analyze your voice to diagnose mental and physical health. Who would have thought that that was possible even 12 months ago? So I'd have you consider the question, what else is going to be possible in the next 12 months? So the idea that we lived in an industry that moved slow, at least in this space, has in fact gone the way of the dinosaur. We've got to move fast, and we've got to remember we've got a mission to accomplish, because it is about reaching our patients. It's about reaching those family members that need the help that our technology, our doctors, our facilities can bring to them. But there's a problem. Most efforts fail, and they fail for a few key reasons. And we're going to talk about that, because this is really not a conversation about technology or any particular online marketing channel. It's really a conversation about new mindsets and new tactics, because the technology is frankly irrelevant if you don't have these in place first. So we're going to talk about a few new mindsets, and these are just mindsets that we've observed with many of our clients and other organizations. The ones that are winning have these kinds of mindsets, and we're going to share with you some of these right now. Number one, first mindset, move from a status quo mindset to a disruption mindset. Now, what does that mean? Everybody talks about disruption. Is probably the most overused word in business right now. My wife picks on me every time she hears me say that on a call, rightly so. But McKinsey did a great job of kind of encapsulating what a disruption mindset looks like, and we're going to actually go step by step through this and actually show you an example of what it would look like to apply this to the healthcare industry. So the 5 steps to a disruption mindset. Number 1, outline the dominant business model in your industry. Number 2, dissect the most important long-held beliefs into its supporting notions. Number 3, turn that underlying belief on its head. and then see if, once you've turned it on its head, if that reframe actually makes sense. And if it does, look at charging forward. So let's look at that. What's the dominant business model in the industry? Large healthcare systems with large hospitals. If we look at the underlying belief, large hospitals are required to improve the health of communities. Let's flip that on its head. Large hospitals are not required to improve the health of communities. So does that make sense? Well, most care actually happens outside of hospitals. So thus, healthcare systems of the future won't have hospitals. And that's actually what we're seeing. The futurists are actually predicting that. And you're seeing the recalibration of some organizations are actually completely rethinking the way hospitals operate and what they might even look like in the future. And this is the kind of thinking that really needs to be applied to every part of the business to be on a footing that's going to allow you to move with how quickly the industry is changing. This quote, in the future, healthcare will be delivered in settings far outside what hospital leaders consider the norm today. That's just the industry as a whole. But again, I'd ask you to take this concept and apply it to any aspect of your business, any aspect of your marketing strategy, your technology selection. See if what your incumbent mindset, see if they make sense. Turn them over, reverse them, and see if that makes sense. You might be surprised what you find. Second mindset to consider, instead of a build it yourself mindset, move it to a buy it. Don't build systems anymore. It's important to know what you're good at and know what you're not good at. Healthcare organizations are really good at doing heart transplants, treating cancer, delivering babies, giving me my flu shots. Historically, and just the record shows, building entire digital ecosystems is not something that is sustainable inside of healthcare organizations. There are organizations that'll do it for a while, but inevitably the people that build it move on, and the organization is left with the remnants of a platform that nobody really remembers how it got put together. We see this all the time. So instead of building your own car, just get an Uber, get the results. There's a reason we don't, for example, build our DVD collections anymore. I actually had a visit to my friend's house this week, and this was on his couch, and he said, I'm sorting out all of my DVDs. I said, how are you even going to play them? And he had made this investment over time, and all these, and we probably all have one of these. I certainly do have a closet full of DVDs, but I don't try to build my DVD collection anymore. I just go to Netflix. They've already built it for me. It's everything I need. They handle the hosting, and they deliver a great experience, and I never have to worry about it. So consider that in terms of this idea of you have to build everything, save yourself the time, find people that can deliver a Netflix experience for you, and deploy. Number 3, shiny object syndrome, moving from shiny object syndrome to results-oriented syndrome. I had a client, senior executive, tell me this. He said, look, we've bought every piece of technology, but we've got no one to extract the value. And he said, it's kind of like buying a Fitbit and thinking that that's going to get us in shape. So that's interesting. And then I said, well, let me see if that proves out. And it turns out that fitness trackers have about a 30% abandonment rate in the first 6 months. Companies do the same with technology. Have you look at the technology suite that you may or may not have, and look at all of the pieces of technology that may have been invested in, both in time and money and effort, that are kind of sitting on the shelf. And what's more important than buying technology is to think about how do we actually get the value out of it. And that's where I'd submit to you that rather than buying a Fitbit, getting a coach is more valuable. You got to have people that have done it before, whether in your industry or other industries, and have a track record and understand the fundamental principles and philosophies underlying how all that works to be able to get the results. They can cut through all of the marketing and fluff that's out there that may be trying to sell one technology versus another. There's a lot of that. You can understand it's very difficult to understand what is valuable and what's real. I have you consider getting a coach. The final mindset shift is moving from leading with the head to leading with the heart. Now, with any large bureaucratic organization, it's always natural to move into these scenarios where you have this idea that the best decisions are going to be made by large groups of people with lots and lots of information. And I'd have you consider that that way of making decision making within the game of digital marketing leads to a couple of outcomes that make it very difficult to compete. Number one, decisions will take too long. The law, two laws here that apply. Parkinson's law: a task will expand to fill the time available for its completion. Typically not a compressed deadline whenever things need to happen. And number two, the amount of time a group will spend discussing an issue will be in inverse proportion to the consequentiality of the issue. We see this all the time, and I'm sure you've all experienced it, where a group gets together and it's very difficult to get consensus because consensus is actually a myth, and you end up spending a lot of time moving into kind of what oftentimes can be a groupthink scenario, which in this space absolutely kills innovation. Wikipedia did a good job of defining this. Groupthink, a psychological phenomenon that occurs when a group of people in which the desire for harmony or conformity in the group results in an irrational or dysfunctional decision-making outcome. Again, this idea of, hey, if we get enough people, we'll get the right decision. It's almost always the wrong decision because of this scenario. There are too many factors, there's too much information, and eventually the desire for harmony or conformity takes over the rationality within the groups. What I have you consider is that small, empowered, and accountable groups are a competitive advantage. Not to say you don't have a group, but it's important that they remain a manageable size, that they're empowered, and they're willing to take account for the decisions they make, and they're supported in the scenario that they are able to make some mistakes. They're able to experiment. They're able to move quickly. The old way of making decisions won't support you going forward. But it actually could be a lot simpler than that, because information-rich decisions with lots and lots of variables, those are head decisions. Those are decisions that are made with the mind and logic, and they're usually a right-wrong. But I found that instead of going with your head, you're just going with your heart. Your heart almost always gives you the right answer. What does your heart tell you? It's a powerful question I had a coach of mine ask me. What does your heart tell you? Made it real clear. So to have you bring that into your decision-making processes, how you think about deploying strategies, technologies in your game of healthcare marketing. Because unlike other industries, as I mentioned, this isn't a scenario where we're dealing with marketing TVs or shoes. We're dealing with issues of the heart, issues of compassion, issues of connection. So in this space, there's a good chance that your heart will lead you to the right decision. So next, we're going to talk about some places to avoid and invest, but I'd like to ask the crowd, tell me what you're getting out of this so far. Any insights? Sometimes the best insights from a presentation like this can actually come from the crowd. So go into the chat box, and any insights that you have, please post them up there, and we'll read them off here as we go through this next section. Any insights, any ideas, any concepts, any feedback, that anything that's triggering here for you that you may feel like might be valuable for the rest of the group to hear. Go into the chat box, post that up to me and the team, and we'll sort through some of those here as we go through the rest of the presentation. So this conversation about avoiding investing started with a friend of mine who is a former CEO of a large healthcare system. And he asked me, he said, hey, Brian, if I was thinking about this space of digital marketing and digital strategy for 2018, what would be the key things I would need to avoid and invest in this year? And this was basically the result of that conversation. I'll just walk you through it. I said, number one, as we just mentioned, you got to avoid these massive enterprise website platforms or built-in house approaches. It's like building your own car. You end up inheriting the cost of ownership of those systems for years. and they're very difficult to get out of. And what you end up with is a kind of downward spiral in many cases, where it becomes the weight of those systems becomes too much for the organization to bear. Just culturally and politically, they're just not, or healthcare organizations are just not set up to support those kinds of technology infrastructures. IT teams everywhere have got much bigger fish to fry than trying to figure out and deal with website platforms or the consumer website platforms. Instead, as we mentioned, don't buy it, just lease it. Don't build your own car, just get an Uber. Get an organization that can deliver fully managed services that can help you deploy quickly and remove a lot of the complexity that would be difficult for you to figure out one time. Find organizations that have done it a lot of times. You leverage their experience, leverage their scale to help you deploy quicker. That act can be unto itself a competitive advantage. Number two, I said you've got to avoid the companies that are built around supporting the status quo, because that way their mindsets, their recommendations, their strategies are going to be based on what supports the old way. And there are plenty of scenarios like that out there. Again, we see this quite often, where the agencies or the companies that the healthcare system has worked with forever, they're still doing the things they've always done forever. They haven't changed because their business model is set up to support that business model. It is important to be willing to disrupt those and be able to say those relationships and those partnerships may not support us anymore, may not serve us, and to start investing in new approaches and skill sets that can help you market in the year we actually are in. And this is going to mean looking for new types of people, looking for new skill sets, new mindsets. And we certainly have seen in the space organizations that specifically bring in marketers and specialists that understand this space, give themselves an instant advantage. Next, I told him, I said, you got to avoid the flurry of activity marketing scenario, where so much of the time what we see as healthcare marketers are always put on their back foot, but because they are understaffed, under-resourced, and then everybody is coming after them to try to get them to market something. And it's really not fair to them. I said, you can't tolerate that anymore. You really should demand that the marketing you do is accountable, and that they're actually that the outcome is actually understood before the deployment of the strategy. I said, finally, again to my CEO buddy, I said, you got to get out of the head in the sand approach, and putting your head down the hope that some of this confusion goes away, because it's not. So you actually need to invest your own time. Your executives need to invest their own time in experiencing what it would be like to be a patient, and what it would be like to be a patient looking for help, to be a father in a delivery room like I was, looking for help, and see what that experience looks like, and see if it's something that delivers the type of brand experience you would want to make sure is delivered. So we're just looking through. I'm going to just quickly look through some of the comments here. See what we've got. So I've got a question here from Dan. He says, Brian, I hear making decisions based on what the heart tells you as an individual. How does a company approach making decisions in this manner? How do they start the cultural shift? That's a great question, Dan. Let me give you an example of how I saw that play out one time. We had a scenario where we were doing a design reveal for a large healthcare organization, and it was one of these, you've all seen it, you've probably all been in it. It's the big, giant healthcare conference room. It seats about 50 people. And we were doing the design reveal of a brand new website for this healthcare organization. We did the reveal, everybody loved it, and there were service line leaders around the table, and they loved it initially, and then they all started realizing that their service line was not maybe featured. And so you can probably imagine how some of the rest of the conversation started to go. And actually the meeting started to devolve. It started to become a tit for tat. Who's more important, one service line versus another. And our project manager, Jenna, did a fantastic job of reframing the conversation. She said, while we appreciate all feedback, I'd have you consider that if you're going to give feedback relative to the design, you must be able to answer and defend one question: how your suggestion serves the patient. And that one question, changing the focus from self-focus to other focus, became the reframe that helped them start thinking about in terms of what serves their patient instead of serves their service line. So Dan, great question. To answer your question, how do you start on a cultural shift? It's about constantly reframing any conversation from a self-focus to an other focus. That's really what making decisions with the heart is all about. Great question. So let's keep moving here. Digital marketing tactics. So we're kind of going down the funnel here. Those are some of the mindsets I discussed, but with my friend. But in terms of digital marketing tactics for 2018, well, there's a couple of things that, the good news is that in general, the bar is not very high. So healthcare organizations that go out and say, hey, we're going to adopt some of these principles. And some of these tactics that I'm going to show you here in just a second. There's an opportunity for you to capture competitive advantage. Most people are not doing this stuff very well, but let's talk about each one of these things. So, number one, manage the entire equation. Number two, run a playbook. Number three, get front-footed. Number four, better questions equal better campaigns. And number five, measure. You add all that up, and what that combines to deliver is really the ability to grab the low-hanging fruit first. And there's a ton of low-hanging fruit for healthcare organizations to go get that is unclaimed. So let's talk about how all of these philosophies play in together, and we'll go through each one. But when we talk about low-hanging fruit, there's a lot of things to consider in terms of where to start. But the basics are things like pay-per-click search advertising. And if you think about really all digital marketing is really just an equation. Pay-per-click is just an example. What we're trying to do is deliver an outcome based on a lot of variables. And with any digital campaign, even the ones that are low-hanging fruit, there's a lot of things to consider. But even that, it can become complex once we start to try to run lots of them, and it can kind of come apart. And this is a challenge for internal organizations. This is a challenge for most agencies. Have a challenge in running lots and lots of campaigns simultaneously with a high level of quality. In addition to that, you've got 1 million people coming to you as a healthcare marketer saying, hey, market me, market me, market me, market me. And you're going, where do I start? Like, where do I start? And furthermore, how do I get people focused on what we're actually trying to do? How do I scale digital in a way that maintains quality and gets us the most bang for our buck? And how do I do this with lots of cooks in the kitchen? I've got 4 or 5 different organizations trying to do different things. What this ends up with is a scenario where when things go right, you don't know why. And when things go wrong, you don't know why. And so results don't become repeatable, which is a good way to spend and waste a ton of money. And as I mentioned earlier, I would again have us all consider that one of the worst things we can do is waste money in our healthcare budgets, because every dollar that we waste is a dollar that could have gone to potentially connecting with a patient or a father that is in need. Instead, it's better to just have one person working the whole equation. And that's what we do at Scorpion, is help simplify and deploy digital campaigns for our clients, but with platforms and technologies that allow us to simplify things and deploy in a repeatable way. One of the other tactics we've seen with many of our best clients that are really getting good at deploying is building a playbook and having a specific set of plays that include all the variables necessary to deploy campaigns at scale, but with repeatability. And of course, you can, the challenge with healthcare marketing is that you've got all these different aspects of the business. You've got different service lines, you've got different community desires, you've got different locations. There's all these things that create a lot of or enter in a lot of variables into the equation. That's where having a playbook that you can go to as a team can really deliver a lot of value. And we've seen this with lots of our clients where we develop these kinds of playbooks that give an easy way to deploy regardless of what the scenario is. And they're all built around formulas that are proven with data. Regardless of whatever your strategy might be, ideally you're creating a playbook that becomes repeatable so that folks in the future know why things went wrong or why things went right. And you have those formulas captured and you're able to deploy them again and again. The other thing that we've seen many of our most successful clients do is they started changing the questions that they asked. And we had a client that said, you know, better questions equal better campaigns. And I thought that was pretty powerful. And this goes from, hey, what are we going to market, to why are we going to market it, and does it make sense? Some of the questions that are important is, and they seem elementary, but you may or may not be surprised how often they are not asked, is, hey, what are your target outcomes? Like, what is the actual outcome you're trying to get before you invest money? Number two, yes, we know you have a very sophisticated technology or program, but is there actual capacity for it? We had a client who had a CEO, as one of their hospitals had a CEO that had just deployed a very high-end mammography scanning unit. Wonderful, beautiful facility. And they said, hey, we got to market this. And the marketers came back and said, cool, but when is it available? And they said, well, it's not available, you know, for 3 more months, and it's only available in beta on Tuesdays between 10 and 2, and it's booked up. I said, okay, well, maybe we should wait until we actually have capacity to market it, because otherwise we're going to create a bad experience all the way around. Number 3, is the patient's journey understood? So when somebody calls, what actually happens? Number 4, what happens when the leads do come in? Does somebody actually pick up the phone? Certainly have seen many scenarios where marketing does a fantastic job of driving demand, but operationally the organization is not set up to actually ingest the leads and actually deliver a good customer experience. But yet, you probably have all seen it, where money is spent to do this, and money in many cases is wasted because the operational aspect of the marketing is not buttoned up. What's the average contribution margin of the patient for this type of service? You may or may not be surprised how often people can't answer that. And without being able to answer that, and other questions related to the economics, you don't know whether it even makes sense to invest money here. So these are some of the kinds of questions that are important to start asking in a world where you're trying to be more accountable and more efficient, because once you get these questions, you can then gauge how your investment should be deployed and in what channels based on what objectives and what is available to go after it. Next, get front-footed with the front line. So this is a shift from marketers waiting for someone to tell them what to market, and instead actually becoming internal consultants. Have a client that has done a brilliant job of this at a healthcare organization in Virginia, where her entire organization has basically become an agency that has gone within the entire organization doing interviews with senior executives to truly understand their business, how it operates, where it can deliver competitive advantage to the organization, what kind of unique capabilities and experience it provides to patients, and what they need in order to drive volume. And this was actually done by knocking on doors, setting up appointments, doing interviews with service line and leaders and C-level executives within the organization. And it was amazing the amount of support that marketing started getting once it shifted the posture from, hey, doctors are going to come yelling at us that we're not doing enough marketing for them, to, hey, we're actually coming to you first. And then finally, measure. You've got to demand measurement. And there's 2 qualities to measurement in marketing that you should expect in 2018. And if you're missing either one of these, I'd have you consider that there may be some opportunity to improve that. Number 1, it should be real time. in terms of digital. If you don't have real-time information, it's out of date the minute you get it. Number two, it must be easy to understand. So we have many clients that have said, yeah, I get data, but it's like 6 weeks old. Well, that's not very useful. The data's value decreases exponentially after it's a snapshot in time in the digital world. Can't react to it, can't adjust, and there's money that's wasted. Number two, it's got to be easy to understand, not only for you as a marketer, but potentially for your senior executives. It needs to be presented in a way that actually helps people understand what's going on. And so there's no real reason you shouldn't be getting this. And if you're not, I have you consider that may be a place you want to go look and start demanding better. So final piece of that, you add all this up, you need to get really good at picking the low-hanging fruit first. And so we're going to talk about what is the low-hanging fruit in terms of digital strategies that are available today. And I'm going to just jump through here real quick as we get to this pause and see what kind of comments we're seeing here. Noska says, I agree. I'm not a fan of groupthink when it comes to marketing strategies. I feel you. Bonnie says she loves the Fitbit example. Suzanne, by the way, that's my #1 favorite name for a girl. It's the name of my wife and my daughter. She says it's scary to think that if we don't have an idea of our social strategy, that we're already behind. Belinda says storytelling is personal, from the heart, appropriate for healthcare marketing. Absolutely. Karen says content is accurate. It's a shame that healthcare organizations are so far behind and reluctant to change. Karen, I'd have you consider that it's folks like the people on this call that actually have the ability to change that. And what it's going to require is some collisions in terms of intellect and in terms of the framing what needs to be done today versus what was done in the past. Heidi says, I love your perception of the future of digital healthcare and the fact that we've only got 70 seconds to, the fact that within 70 seconds from your daughter's birth, you had Googled and gotten information to act on your problem. Tom says, no breakthroughs, but some good reassuring insights. Absolutely. Well, again, we're all kind of in this, we're in this boat together, and that's one of the things that we like to do at Scorpion is actually get our clients together and look for opportunities to collaborate, because as a cohort of individuals who are looking to say, I need to do something better, like it's important that we kind of band together, and that's kind of part of the culture at Scorpion and many of our clients. Mary says small groups are more nimble, tricky, but valuable for healthcare. Absolutely. It takes strong leadership more than anything. Kara says act quick and break through the noise. And Molly says, I missed the beginning. Will a recording be sent out for this presentation? Absolutely, there will. Our friends at Becker's are going to take care of that. We're going to have that on the Scorpion Healthcare side as well. And then we've just got more questions here. We'll come back through some of these as well. And Lisa, you actually asked a question here. You said, what do you recommend for markets that are more blue collar, low income, that are not tech savvy? Let's talk about that. That's a perfect segue. And thanks for queuing that up for me. So let's get back to the really low hanging fruit. Really low hanging fruit, it comes in a couple of categories. These are the things you got to block and tackle. They're easy. If you have the right people on your team, right companies, right organizations, but they're opportunities to grab some easy wins. Number one, search marketing. If you're not doing that, you should. Not all search organizations are considered are equal. You need to find organizations that have a background there and really understand it and can manage the entire equation. Number two, listings. That's how people find you. Facebook, YouTube. We'll talk about both of those. Move faster and deliver accountable results. So we're going to go through each one of these. Some of this may be elementary to some of you, but it's important to go back to the basics of the why behind each one. So search is important because that's the most intentional time for marketing. That's what got me to Scottish Rite. I needed an answer, and the internet provided it to me. Specifically, Scottish Rite did. Why? Because of immediacy, relevance, and targeting. It was in a targeted ad. It was relevant to what I was looking for, and it gave me immediately what I was looking for in that moment. Search advertising, if not deployed purposely and with thought, can be a good way to burn a lot of money with some purpose and some thought and some intentionality around the idea of managing the entire equation. Again, I went back to that equation with lots of variables. You need to be able to manage that, and you need to have an organization that manages the entire thing to get maximum value. There's huge opportunity there to be the voice when your consumers in your communities are looking. Lisa, to your point, what do you do in more blue-collar, low-income areas? Don't fall for the fallacy to think that those people are not on the web. Everybody is on Facebook. Everybody has a smartphone, and when they look, they're all going to the same place, regardless of income level. Number two, listings and locations. This is just, again, basic blocking and tackling. We all know consumer behavior has changed in terms of we're all carrying around a GPS device in our pockets. We're all looking to find relevant results. Near me searches have increased 3,400% since 2011. You need to have that piece of your game buttoned up. There's a lot of complexity into how that works. The way Google and other search engines figure out where something is, the actual where and what of maps and listings information is hugely complex, not something that your organization needs to deal with. You just need to find somebody that can sort this out for you. There are online listing management services and syndication technology that now make this cleanup and automation completely seamless. Hand that off, but get it done. It's important to have this piece of your game buttoned up. You don't want people going to the wrong building for the ER. One example of this, we had a client that had moved their ER and had not updated the map, and this prior to them joining Scorpion, and there was an ambulance that went to the wrong location because the ambulance looked on Google Maps. So those are kinds of things that you just got to button up, and you have a liability to do that as a healthcare organization. You got to deliver accurate information. If you can't get the small things like that right, then how can they trust you for the big things? Also, Facebook. Regardless of some of the recent Facebook challenges, it's important to understand that this, in terms of trading value, in terms of underpriced opportunity for impressions, Facebook is still one of the best bargains out there. One of the things that we hear about is this kind of comment, kind of again, along what you had said, Lisa, you said, how do we've got maybe a blue collar or a low income area. I've heard many times, well, our area is an older population. They're not really on the internet. Couldn't be more untrue. The reason why is grandchildren. And and again, this study just kind of shows this: teens leaving Facebook but being replaced by more users 55 and older. My dad, who is 70 years old, famously in our family said, I guess it's been about 5 years ago, 5.5 years ago, famously said, "I'm never going on Bookface," to his children. And we said, "Okay, Dad, well, it's Facebook." And he said, "Well, I don't care what it is. It's a waste of time." Okay. Fast forward 36 months, when in that period of 36 months, he had 6 grandchildren. Now my dad is on Bookface every single day and has about an 18-minute lag between when I post a picture of his granddaughter and he likes it or hearts it. So that's happened all over the world. There's opportunity to get in front of those folks that need heart screenings like my dad needed, need heart surgery like my dad needed. He's doing great now, by the way. And all of the other services that target that demographic, they are on Facebook, and they scroll really slow and read everything. My dad constantly doesn't quite understand why I don't see what he sees on there, but I let him continue to go. Another opportunity, video. So most of our clients have huge libraries of video that they've produced over the years, commercials that they've done with their agencies and so forth, lots of video content. There's opportunity to potentially repurpose some of that content, but bring it online. The old TV commercials have a shelf life. They're very expensive. TV time, very expensive. serves agencies that sell that stuff very well, which is fine, not hating on them, but there's opportunity to get even more leverage online with that. YouTube is the world's second largest search engine, and you've all seen it where ads or pre-roll is being targeted on YouTube to you based on the content you're searching for, based on your profile. The data shows that people go on YouTube prior, during, and after treatment. There's an opportunity for you to be a voice there and be a brand that delivers clarity in that space. And the medium of video delivers a very high level of certainty and trust in a very short, compressed amount of time. One other opportunity is worth bringing up is direct-to-recruit marketing. We're seeing this in many of our clients where the HR team is coming to marketing and saying, hey guys, the recruiters are murdering us. The mailers, $60,000 in mailers that we just sent out didn't deliver any results. What can you guys do to help us? And they come to us and say, what can we do? We say, yeah, very easily. You can go online and market and try to do recruiting yourself, direct to recruit marketing. We have a client that in the last 4 to 5 months, they told us they've saved somewhere on the order of about $40,000 in recruiting fees by being able to attract 2 specific ER nurses that needed positions to fill. So those are all some of the kind of low-hanging fruit: search, listings, Facebook, video, direct-to-recruit marketing. Get those things buttoned up. There's no reason not to reallocate or redirect budget towards some of those things and be able to grab that. Obviously, you need to find the right people to help you do it. Not all organizations are made the same. So just want to read a couple of comments here before we talk a little bit about some things that are on the horizon. Let's see here. David says he's encouraged. As a consultant currently helping a small indie hospital, I've begun many of the strategies you've outlined. Question: Can this actually be implemented effectively bottom up versus top down? Yes. Fantastic question, David. Yes. So example of bottom up is search. If you can just deploy search, you can get people in that moment, and you don't have to invest millions of dollars to do this. You can deploy some campaigns. You can capture some attention. You can get people to interact, and you can show the data and prove it to the organization. Again, doesn't take huge amounts of investment, especially in rural areas. You can get a tremendous amount of leverage in those areas by using digital marketing if you can dispel the idea that those people in those rural areas aren't online, which is totally not true. So yes, a bottom up is 100% a way to get quick wins that then you can start to sell within the organization. Let's see. Rob says, will you be making the presentation available? Yes, we'll be making this available later on. Paula says, do you have any tips for implementing a successful B2B search marketing campaign? Yes, absolutely. As you might expect, that's something we do. We're obviously marketing to other businesses. Probably a little bit more of an extended discussion. Lisa, Paula, feel free to reach out to us after the conversation, and we'd love to have that conversation with you. And that applies to B2B Facebook marketing as well. Tom, you said you love the book-based example. I will share that my dad now is famous. I appreciate that. You say, Lou says, listings is so important and hard to fix. Great point. Hire someone that can do it for you. Absolutely. ID says, I'm sold and I'm a hard sell. Love that. Let's see if we can go help some of your folks inside recognize how important it is to have leaders that want to make change in today's world here. Any other tips for reaching Medicare population for populations other than Facebook? Christine, again, probably an extended discussion and possibly a little bit custom based on where you are. Love to have that conversation with you. So now we're going to kind of wrap up the presentation of a couple of things on the horizon. So we've talked about where we are, but let's talk about what's coming down the pipe and some of the considerations and opportunities that's going to deploy. Number one, big one, ADA compliance. Huge gray area here. Your hospital may have received a letter from a trolling lawyer saying, hey, we're going to sue you. I've got some guy that has a problem with your hospital's website, and now we're going to sue you, so please send us $5,000. If you haven't received one of those letters, you probably will. ADA compliance has been one of these things that's been in a gray area, and again, we probably will have another webinar that talks specifically about this. But the bottom line here is that as an organization that is serving the community, it's important to basically do the right thing and make sure that your experience delivering online will give folks that have disabilities or accessibility challenges answers that they need too. And there are ways to do this. There's technology, there's design processes, and there are best practices and talent around how do you design in an ADA world and not look like a DMV website. And once you've got it that way, how do you maintain it? I'd have you consider that maintaining ADA compliance for your hospital's website is the last thing anybody on earth wants to do. It's kind of like taking out the trash. Nobody wants to do this, but it has to be done. And there are technology and processes that can help you here, but this is something that's going to become more and more important. Lots of elements of this to talk about, but the bottom line is it's incumbent upon healthcare providers to make sure that their content is accessible to everyone. Number 2, AMP, or accelerated mobile pages. You may have heard a little bit about this. You probably experienced this. AMP is a way that Google is leveraging content specifically in media and community relations and PR, where those types of pieces of information and content can be delivered at extremely high speed, and there's certain ways that this can be deployed to help findability, if you will, and really show up as a very authoritative page by simply having the format right. You need to look at technologies that will open that game up for you as well. And then finally, voice. As I mentioned earlier in the presentation, voice has been one of the things that's changed dramatically. It's important to start considering strategies about how specifically you deploy content that will work in a world where voice searches are going to gain more and more dominance. What this really alludes to is moving away from as much clinical talk and moving into conversational content that is in the voice of the way people speak. And again, if you'd like to have any conversations around this stuff, we're happy to have a conversation. But those 3 things, ADA compliance, AMP, voice, what if there was a platform and technology solution that actually kind of solved all this for you? Well, guess what? Here's our shameless plug for Scorpion, the ultimate digital platform for healthcare systems. We've been in this game for over a decade, and we built platforms around this, both in content management, digital marketing, and kind of all of the pieces within that, SEO and so forth. Well, our CEO has an absolute vision for this, and we have invested a huge amount of effort and resources in bringing the next generation of this platform to market. And we've nicknamed it Project Redwood, being out from California. We're going to have a special reveal event, May 31st, 2018. You're on this call, you get an in if you're interested. Basically, the way to get in is to go to scorpionhealthcare.com, go to the form at the bottom, enter in the form, I want in, into the form to get on the list, and we'll give you more details in the coming weeks. Really exciting. I want to be able to show you some of the amazing stuff that's coming. It's going to be a dream for healthcare marketers, and it's been built. Imagine if somebody built the platform just for healthcare marketers. That's what we've got coming down the pipe, and it is beautiful, amazing, and our CEO is really excited about it. I can't wait to see what this can do for healthcare marketers that need help. So that's, again, to review that, scorpionhealthcare.com, in the form, type in I want in, and again, we reserve this to press and industry only. I want to leave you with a quote from a good friend of mine, Dr. Royer, who's part of Royer Maddox Heron Advisors, consulting organization that consults with hospital CEOs. In their book, Breaking Out of Healthcare Abyss, they said leaders must nurture their dissatisfaction with the status quo by constantly re-examining current reality and living in a permanent state of inquiry. And I'd have you consider that that is the mindset that's required to lead today. But more than anything, the thing that's required to lead and truly serve both your organization and your patients is to just lead with the heart. It really is pretty simple. There's a lot of information that can be confusing, but usually what your heart tells you is the right thing to do. So with that, I'm going to wrap up the presentation. I'm going to leave you with 2 takeaways, and if you hang out for 1 more minute, we're going to have an Easter egg for you since it is Easter weekend. That here's where the prizes come in, so hopefully you've all been paying attention. One more recap on this. On the reveal event, May 31st, 2018, Project Redwood, the ultimate digital platform built for healthcare systems. go to scorpionhealthcare.com. In the form at the bottom of the page, type in "I want in the form, and we'll get you on the list. Number 2, if you'd like to receive a free copy of the book, Breaking Out of the Healthcare Abyss, go to scorpionhealthcare.com and enter the word breakout into the contact form. The first 30 entries today after this presentation will get a free copy. And we are going to go a little bit over time here to take some questions. But again, if you want a copy of this book, highly recommend it. This is a great book for any leader in healthcare today that is looking to bust the status quo. And it sounds like, based on the comments that we've had so far, that a lot of the folks on this phone are interested in being leaders and not accepting the status quo anymore. So we're going to do a few minutes of Q&A, and then if you stick around for the Q&A, we're going to have one more Easter egg for you after this to win one more prize. So we'll do a couple of questions here real quick. Let's see here. So one question that just came in, it says, if you could just do one tactic inside of a healthcare organization and if you could do just one tactic inside of a healthcare organization to start shifting mindsets, what would that be? As I mentioned earlier, it would be moving from a self-focus to an other focus, always reframing every conversation with that scenario, with that mindset of every time there's a conversation, we just ask, how does this serve others instead of serve ourselves? Another question here was, what would be the main thing that differentiates the most competitive hospital systems when it comes to executing digital strategies? It's what we just talked about. It's leading with the heart. Because leading with the heart allows you to move quicker. It allows you to be okay with making some mistakes. And it always orients you to an other focus, which is so important in healthcare marketing. And just having an other focus by itself can be a differentiator. You have all seen it and probably maybe done it, where you've got all of the awards and stuff on the airport wall. I just came into an airport yesterday and saw a healthcare system advertising all of the awards they've gotten. But if you actually thought about the way they were framing it, the awards were kind of meaningless to the viewer. It was a self-interested approach, and didn't really provide any value to the person walking through the airport. It was a huge waste of money that could have been probably used somewhere else. So to wrap that up, again, here's the Happy Easter. If you're still on the call, we've still got a lot of people on the call. Here's an opportunity for you. So read the book, Crushing It by Gary Vaynerchuk. Some of you may know Gary Vaynerchuk, some may not. If you don't, I'd have you also consider that the best healthcare marketers today are thinking like entrepreneurs, both in terms of the way they deploy, in terms of speed, but also the way they're operating inside of their own organizations as intrapreneurs. And Gary V is one of the best at this. Great book. We're gonna give away 10 copies of this today. And here's the Easter egg. Go to LinkedIn, search for Brian Q. Davis, Scorpion Healthcare, and connect with me. And enter in the message my daughter's name, Perry. And 10 of the people that connect with me today will be entered into a drawing to win a free copy of the book. So go to LinkedIn, Brian Q. Davis, enter in my daughter's name, Perry, and you'll be entered into a drawing to win a free copy of the book. Fantastic book. Really will get you fired up. And also realize that you, as a marketer, have a story to tell as well. At Scorpion, we often say that the most unsung hero in healthcare is the marketing executive that's doing the work on the front lines of your healthcare system every day, and most of the time in a thankless environment. Well, we appreciate you, and we love you. We're pulling for you. That's the reason we will go to work. That's the reason we build things. That's the reason our company is set up the way they are. Is to support the healthcare marketer who's out there fighting the good fight. And we believe that you actually have a story to tell too. This is a fantastic book to start thinking about that. And I look forward to connecting with a lot of you on it. So with that, feel free to reach out to us at Scorpion. You can find us online, find me online. Please reach out and connect. If there's any conversations that you'd like to have as a follow-up here, we'd love to have those conversations. I want to thank you all for your time and attention today and investing some time to think about how to no longer be satisfied with the status quo, but instead differentiate yourselves and your organizations by leading with the heart. Thank you so much. And with that, have a fantastic day.
Thank you, Brian, for that excellent presentation, and Scorpion for sponsoring today's webinar. Everyone in attendance, please enjoy the rest of your day, and we look forward to having you join us for future webinars.